information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to the Healthy Dose podcast. I'm your host, Dr. Joe Gambardella, and I am very pleased to have with us today a special guest. His name is Jacob Sanchez. He's a friend of our practice, Advanced Physical Medicine and Rehab. You can find us at apmrmiami.com. Jacob is a board-certified registered nurse anesthetist and also a master injector. He's going to tell us more about that. Graduated cum laude at the University of Miami, receiving recognition for teaching and excellence by Harvard University Anesthesia Department and the #1 ENT hospital in the country 3 straight years. Pretty incredible, Jacob. Welcome.
Thank you, Dr. Joe. I just want to make sure that I start with, I'm a huge fan of APRM. I can't thank you enough. I feel honored to be here next to you.
Yeah, and same. Jacob, you can find Jacob. Jacob has a pretty big following on Instagram. Jacob, how do people find out about you?
You can follow us at GetRefresh1 on Instagram. You could also follow us on Twitter and also YouTube. Yeah.
Perfect. And we're going to get into that, and we'll give out those links in a few. But Jacob, the reason that we're talking tonight is because we share similar philosophies in practicing medicine. I specifically want to talk about some of the things that people come from all over the state to see you, all over the country to see you in terms of cosmetic, basically reformation, right? They're fixing their faces, changing their lives, changing their bodies overall.
It's incredible.
And it's done non-surgically.
Non-surgically,
right?
yeah.
And without any type of medicine that's long-lasting.
Right. So what I was doing 3 years prior to this, I was an anesthesia provider. I was working with over 40 different surgeons throughout Miami-Dade, Broward, in South Florida. And I saw the trend. And I was also working in the hospital. I had my foot still in the hospital in a clinical setting. And I saw the trend of medicine. Everything is becoming more non-invasive. Mm-hmm. From hearts to when I was doing, breast augmentations or rhinoplasties, basically surgery for the nose. Everything's becoming more non-invasive. That's where people are leaning towards. It's modern medicine, and people through social media have the exposure of finding out, wow, there's an alternative.
Yeah.
So they don't have to keep biting their tongue on the fear of going underneath the knife. Also for myself, I was also thinking, if I do this for 30 years, I'm doing anesthesia, the potential for something to happen is always going to be there. So it's a game of numbers. And when I saw where, as far as aesthetics, I saw it in the plastic surgery world. I was like, wow, I'm not putting somebody's life at jeopardy. It's completely reversible. So I can rest peacefully at night, and I'm receiving self-actualization because these people are getting up from the chair crying.
It's an amazing feeling.
It's an amazing feeling.
It's funny that in the world of aesthetics, it was kind of trending in that direction. I could tell you in the world of physical medicine, the trend is still surgery first, deal with the complications after, which is kind of how we got our footprint into this field, is because we teach people about natural, safe alternatives to joint replacement, different types of conditions to manage these ailments that once they have surgery and lose a joint, we're not dealing with just faces, but joints, people retaining the ability to walk for the rest of their lives. it's a life changer if it goes wrong. And oftentimes with complications, as you can attest to, from simple rhinoplasties where you're going under anesthesia, if you're getting a knee replacement and you're going anesthesia for any given period of time, there's complications that patients need to be aware of, and they don't even think about them.
Absolutely.
Right? They just think about the end result. They're going to be pain-free. They're going to look great. And how many times is really that the case, where people feel incredible with the surgery that they've had? They wind up being pain-free. I could tell you on our side, it's less than 50%. Less than 50% of people who have a complete and total joint replacement, less than 40% of the people who have fusions in the lower back get any kind of relief that they were hoping for.
Yeah.
But the complications of anesthesia, as we'll talk about with bioidentical hormones, it makes them anemic, right? It changes blood chemistry for months in terms of getting them back up to healthy levels. Their iron becomes lower, their iron saturation levels change, and they lose energy. They become anxious, and they're still in pain. So that's why alternatives are so important. Tell us a little bit about how you work with your patients. Do you use anesthesia?
I do. Having an anesthesia background, especially a specialty in anesthesia, has really propelled our practice. Because we know through research there's 3 reasons why people are hesitant on getting fillers. 1 is bruising. 2, pain. 3, cost. So we've taken that, and we're conscious of it, and we've tried to make it attainable, pain-free, and how do we cause less trauma?
Yeah.
I'm sure it's the same way you're seeing, okay, this is the problem. How can I address the problem? Not from a tertiary standpoint where you have to get surgery, but preventative.
Yep.
It's preventative medicine
Absolutely.
as well. Because it's a vicious cycle. That's a wild number. 50% of people are still suffering from pain after the intervention, after the surgical intervention, with the cost being so high. I can't imagine the cost for a knee replacement.
Yeah, it's about $60,000.
$60,000, the rehab, if it's a back, I'm sure.
It doesn't cover. That's not including deductible. It's not including co-payments for physical therapy visits before and after the surgery, most of which are not covered.
Yeah.
You need many more visits than your insurance can cover. All of the alternatives like regenerative medicine using ozone and prolozone, which we've spoken about in previous podcasts, using allografts that contain stem cells, they're not covered by insurance, but they're necessary. So it puts a big burden and an obligation on us to make it affordable to the patients.
Right.
And so, it takes the stress off of someone coming in thinking, how am I going to afford it? It's on us. We'll make it affordable. We just have to make sure you're an excellent candidate to get these procedures done. And once you clear that hurdle, then the rest becomes
That's
easy.
the same approach we take.
Right?
And it's been so successful.
Yeah.
That's why we have people flying in from not only the United States, but around the world. And it's crazy that people are flying in for something that's actually temporary.
Yeah.
This is not, what we're doing is not permanent.
Yeah. So I could tell you, the patients that we see, they're interested in aesthetics. They don't want to have a scar for a knee replacement. They want to walk upright. They're concerned about their posture, which goes into facials, right? So, what does someone do? The most common things that we see with aging, we'll talk about a little bit about hormones, testosterone and growth hormone in particular. 20 to 30 is when we go from optimal to insufficient amounts. Growth hormone is so important because, as you know, in aesthetics, it keeps the skin thick. It helps prevent the deep crevices and the deep wrinkles. It keeps the hair full. Testosterone between 30 and 40 goes from optimal to insufficient. It doesn't mean because we make less, we need less. We need to keep those levels elevated and balanced for the course of our life. We'll talk more about that. But when those levels drop and the face changes, people, they're not ready to accept that. And so while they may not want to go for a facelift at 30, they may not need it, but they don't feel their best. What do they do? They come in, they get screened, and what do you do? What's that first visit look like?
Well, the first visit, I sit down with them. I usually ask, okay, what is your concern? I don't want to give them a complex about something. Right?
Yeah.
So I go in, okay, what's your concern? They voice their concern. Okay, my skin looks like it's thinning. I feel like my face is falling. The fat pads are getting smaller. I'm getting these lines. And then I look at the face from a holistic approach. I'm also looking at their psyche too, to make sure that they're a right candidate. Because sometimes it doesn't matter what you do. You can give someone the most beautiful outcome. But this is what's more important than fixing someone's face and balancing out and causing harmony with all their facial features is what's inside.
Right.
And sometimes you get around that age, I think the magic number, I would have to say, if I can pinpoint it, it would have to be like 36, 38.
Yep.
That's when people start freaking out, male and female.
You know, and just think about this in the global scheme. Athletes, right? Most of the athletes in the NFL by 30, 31, 32, they're retired. Baseball, it's mid-30s. So, you know, physically, our skills go, our cosmetic, our appearance starts to change, and that's really when you want to address it first, right? You don't want to wait till you're 45 or 50, although you can, but it's much more difficult to get that balanced, refreshed look, that natural look.
Absolutely.
If you wait so many years.
Absolutely, because you don't want to. The goal is not to essentially make. If you're 40 years old, it's not essentially to make you look like you're 20.
Yeah.
It's about making you look like the best version of yourself at that age. And if you wait till you're 50 and you want to turn back the hands of time, you want to stop that clock and then rewind, it's going to be very difficult. Yeah. So I think the best approach is just maintenance, keeping it up. And now, I mean, it's funny how now that I'm sitting next to you, I'm really seeing the similarities between what we do.
Yes. Yeah.
Like they're coming into the door because they're seeing the physical signs of aging. Mm-hmm. But even with your like hormone replacement,
yes,
I picked up a book the other day where there's studies to support that it's even preventing certain cancers and Alzheimer's.
You know, it's an excellent point. We've touched on that in future in previous episodes, and you know, one of the biggest misconceptions, there are many. There's a lot of myths about bioidentical hormones. One of them being that taking bioidenticals or increasing hormone levels to optimal causes cancer. There's no data to support that. When your hormone levels are the highest they'll ever be in your entire life, 18 to 25,
you're healthiest, huh?
The healthiest you'll ever be.
Yeah.
I mean, there's incidents where you'll see an outlier, someone has cancer, but who has high blood pressure, who has hyperlipidemia, who has breast cancer and prostate cancer when they're in their 20s, and your testosterone levels are the highest. As we age and we go through our 30s and 40s and the testosterone becomes depleted and we become relatively estrogen dominant, our diet changes, cholesterol increases, we become insulin resistant, we're storing belly fat. So the combination of increased belly fat, higher estrogen, that's what leads to vasoconstriction, closing blood vessels, and that is evidence linked to different types of cancer. Mm. So, you know, the whole cool. idea is there's so many studies out there to support this, but there's a lot of data out there, bad information, that created a hormonophobia in the late 90s. All of these studies were retracted, and all you have to do is look at our previous podcast, apmrmiami.com, go to great radio shows, and look up the link on myths about bioidentical hormone replacement therapy, and I cite those studies. So you know, again, to parallel, you're treating something from the outside in right now. Mm-hmm. You're going to be getting more into the bioidenticals because it's so important to treat from the inside out as well.
Absolutely.
And then you treat the whole person.
Absolutely. We have a lot of clients that are coming in.
Yeah.
Who are already on bioidenticals and hormone replacements or peptide, type regimens.
Yes.
And they're usually couples.
Yes.
And they're coming in as couples. They feel great.
Yep. But now they want to look great.
Yeah, they feel great. Now they want to look great.
Yes.
And that's where they're coming to us. And I'm in the field of, some would say vanity.
Yes.
But it's not necessary. It's not the case at all. It's not the case at all. I really feel like the face is just the present. It's like the gift wrapping for the present that's really inside.
Yeah. But it's the first thing you see in the morning, right? You're looking in the mirror, you're brushing your teeth, combing your hair. You see it every day, so you have to feel good about yourself.
Absolutely.
Let's talk about the good stuff now.
Okay.
Right? So for you're talking about, you mentioned couples, so this is for men and women.
Yes.
So the best way to do this is come in, do it together, get the results together, fall back in love, fall deeper in love, right? That's what it's all about. So I could tell you for men, like one of the things they get most concerned about is the double chin, right? So they've dieted down, they still have some saggy skin. There may not be a candidate for Kybella because it's not so much a fat deposit that's left, it's saggy skin. And I tell you, I've seen some of your before and afters, and it's absolutely amazing. Absolutely amazing. So you see a squared off jaw, flat underneath the chin. The patient looks 15 years younger. How do you do it? How do you do it? I mean, I know it's like facial contouring using fillers. It's proprietary. You're not going to give it away, but like,
no. I don't mind because we teach this.
And is it something that's done in successive visits? Do you get the bulk of it done in one visit?
Well, 60% of our clients are flying in, so we have to get it done that day.
Wow.
So we can schedule them for a follow-up. It's a combination. It's a combination of a little bit of art. You have to have that artistic eye.
Mm-hmm.
And then there's a little bit of math involved. We've known for centuries that there's certain ratios that you have to pay respect to.
Mm-hmm.
But we don't know that, right? The common Joe is going to look at you and be like, well, is this person attractive? But your brain is processing like 100 things at once.
Right.
They're looking at the spatial distance between your eyes. I should be able to take, with calipers, a measurement of your eye by the millimeter and fit one right in between both eyes, right? And 1.5 on each side. Your eyebrows should line up with the top of your ears. Your columella, the bottom of your nose, should line up with your earlobes.
Hmm.
The top lip should be 1/3, bottom lip 2/3. From this space, from underneath your nose to your cupid's bow, should be 1/3. Underneath your bottom lip to your chin, 2/3. The chin should be 1/3 of the forehead. So it's a little bit of math, and then having that artistic eye. And then
together.
Now science, you're like, okay, now we have some bomb fillers that are out on the market.
Yes.
The technology that's behind them, it's hyaluronic acid,
Mm-hmm.
which is something that you naturally produce in all the tissues of your skin, your gums, and your joints,
Mm-hmm.
just composited in this gel-like matrix. And it's hyaluronic acid, so you can reverse it because you have the reversal agent floating within your body too. It's
Mm-hmm.
hyaluronidase.
Yep.
So just using the right tool for the right job. So when you put it all together, it's like, okay, this person's coming in. Sometimes they don't even know what they're coming in for. Sometimes they're like, my nose looks really big and I want to get it fixed.
Yeah.
And I'm like, okay, I don't think it's necessarily your nose. I think it's your chin. Your chin is so small and it's not in ratio that is, when somebody looks at you, the most attention that's being grabbed is towards your nose. People are gravitating towards the biggest feature on your face.
Mm-hmm.
So if we correct the ratios, we can harmonize all your facial features so no attention's being taken anywhere and they can just look in your eyes. That's what you want.
Yeah.
Right?
Yep.
Even with women, some women come in and they're like, I want my lips big, I want Miami big, And it's like, no. That's not really what you want. You want people to not be drawn by a certain facial features, unless it's your eyes. So
you sit down, you map that out, you do your consultation with the patient, and then's the procedure. So you mentioned you do use anesthesia, obviously, right, with some fillers. Do you use a lidocaine cream for 15-20 minutes to numb? Do you actually? It's all local, right? You're not putting anybody to sleep.
No. No, it's not. I would love to. I would love to incorporate that part of science, just because anesthesia it's an art itself, and I love doing it. But it's kind of like killing a fly with a shotgun.
Yeah. Yes.
I would love to, but what we do is we use BLT cream, is benzocaine, lidocaine, tetracaine, in this. It's like a gel.
Yes.
Essentially, we let it sit
for
in the areas
for about 15,
for
20
about
minutes?
15 minutes. Sometimes even less. It's really strong. And then I'll go in there. I'll be like, okay, let's say, for example, let's say we're doing the lips. I'll put BLT on the lips, but I also put it on the outside of the lips because I'm going to go in there with a cannula.
So face is numb, lips are about to get bigger. We're going to find out right away, right after the break, how Jacob does this, and we'll be back right after this.
Thank you.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
And we're back with Jacob Sanchez from Get Refreshed. You can follow him on Instagram at GetRefreshed1. And right before the break, Jacob was telling us about lips, Miami lips, right?
Yeah.
Maybe not necessarily the best thing, but tell us a little bit about how you work from the nose down.
Well, yeah, whenever you work on a face, you always want to work from the top down.
Okay.
But as far as to go back to how we numb,
Yes.
with the anesthesia background
BLT.
at Get Refresh, we use BLT. We use ethyl chloride spray.
Okay.
Have you ever heard of that?
The free spray. Yeah.
Yes, the free spray.
Yeah, we use it all the time too.
Yeah?
Yes.
Awesome. So I used to use it when I was working back in Boston doing pediatrics, putting in, IVs for, these small babies.
Mm-hmm.
I just spray and then it'll numb the area and then I'll go in there. And then we also use, we blocks. We do blocks. We can block the nerves that innervate the area that we're going to work on
Mm-hmm.
to make them feel completely comfortable.
Fantastic.
Yeah.
So they come in, a typical procedure, you said you're doing more than one, right? So it's facial balancing, so you're looking at jaw, at nose, at the distance of the eyes, the fitting an eye in between.
Right.
What's an average procedure typically lasts when someone's traveling in to see you? Consult is, if they have an appointment at 9 a.m., what time will they typically be seen? Will they be seen pretty close to their appointment time?
Yeah, oh, absolutely.
And then,
I mean, at Get Refresh is not just about the fillers. It's about the experience.
yep.
We want to destigmatize the negative connotation that goes with getting fillers, Botox. That's back in the days when people were just over-injecting themselves. Most of the demographic was like in the 70s, 80s. And that goes back to our first statement where you waited a little bit too long to actually, turn back the hands of time.
Mm-hmm.
Now we have people, with these millennials that are coming in. This is almost like getting a haircut. Actually, hyaluronic acid, you can reverse. It'll go back to normal before your hair grows back.
How about that?
If I botched your hair.
Yeah.
So this is becoming part of people's lives. Like, okay, it's almost like a teeth cleaning, almost like a haircut, almost like getting a facial. This is where we're going with modern medicine because we are becoming experts at it. So when they come in, I'm looking at their face and I'm like, okay, what's your concern? Okay, I think we can do this. So we can balance out your entire face so that no features points out, right?
Mm-hmm.
And that typically will last. If we're doing facial balancing, that's going to, when they sit in the chair, after being numb, taking pictures, it's about like an hour.
Okay. So then they get the procedure, they look great, they feel great. How soon can they go back to their normal life, working out?
Usually there's no downtime.
No downtime.
Now, however, there's a healing time. I think those are two different things. No downtime, I can go to work.
Okay.
I went to work the next day. Healing time, I'm not trying to increase. I don't want people to increase their blood pressure by going and working out. Just in case, we're inserting a needle. The face is very vascular.
Mm-hmm.
So if I compromise a vessel and then you're increasing your blood pressure by going to the gym that day, it's going to bleed more. You're going to get more bruising. So that's what I mean by healing time.
So healing time, you typically tell them just take it easy for the day, a couple of days, a week.
Typically 2 days.
2
You'll
days.
be fine. If it's just like a neurotoxin, like a Botox, Dysport, Xeomin, just 6 hours.
Are the final results, are they seen immediately after the procedure, or do they take a couple of days to set in?
It depends where in the face we're working on. Like, as you've seen, like with noses, that's instant gratification.
Yeah.
That's why it's my favorite procedure, because they see how they look.
And you're really becoming known for that. In fact, I think we learned you just became certified teaching a course.
Yes.
So when people want to know, other doctors out there, other nurse anesthetists that are getting into this field, don't relearn this because this is an expert right here. He's teaching the course. How do people find out about the course, about credits, about the cost of it, where you're holding it?
The easiest and fastest way is through social media. They contact us on our handle, Get Refresh One.
Mm-hmm.
If you can send in a DM, a message, or on our profile, there's actually a link that is an Autobot and will run you and answer every question that you may have. And you could always, if at any point through that process you want to speak to a live representative, you can.
So
you can even speak to me.
If someone found you in California and they want to learn about this next month, is this something you'll do specifically for certain offices, or are you only doing courses at specific times throughout the year?
Yeah, we're holding it quarterly now. Now that we got our accreditation, we're going to be holding it much more frequently and opening other courses that people have voiced their interest in. This is right now we're just trying to get our name out. Most doctors most specialists don't even know what we're doing.
Yeah.
I've had patients come to me and they're like, "Hey, my doctor said it was fake. He said it was plastic. He said you're modifying the nose and it's all Photoshop." And I'm like, That's the best compliment you could possibly give me. I love it.
Yes.
I love it. We have, plastics in other countries. They're like, no, this guy is, I don't know, something's not up. And some people are the ones who jump on the bandwagon first, they're gonna benefit from it. It's gonna become much more lucrative for them.
Yeah.
This is what's happened to me. I saw the wave where there's a wave that's about to come down. You have social media. It's a multifactorial issue. You got social media. Millennials are using it. People they're searching for a more non-invasive method to their overall well-being. According to the American Society for Aesthetics Plastic Surgery, facial rejuvenation using a surgical method has increased by 19%. A non-surgical facial rejuvenation, all those methods have exploded by 6,590%. The people who learn the latest techniques first are going to gain popularity.
Yeah.
This is going to be incorporated.
And when you're first, you're best in social media, right?
Exactly.
Right?
Exactly.
So this is a key thing for patients, because we've experienced this in our practice too. They'll go back, they'll speak to their quote-unquote doctor, and they'll say, it's not real, it doesn't work. And when your doctor says it doesn't work, 9 times out of 10, it's because they don't know about it.
Yeah, absolutely.
And egos are very big in the medical field.
Oh, absolutely.
Right? So, like you said, that's a great compliment. We get that oftentimes when patients say, I went to my doctor, they said stem cells don't work. And we know stem cells are healing cells. And I said, well, if stem cells don't work, you wouldn't be here. Because you'd only be here a day or two if you didn't have a stem cell in your body. So we know they work. Gravity works. If you don't believe in gravity and you take the chance of stepping out of a building, whether you believe in it or not, it works. So it's incredible that you've been able at such a young age to come up with these amazing artistic techniques that are changing people's lives. So when a practice, like we said, someone in California, they contact you, they come to the quarterly, they have some background in fillers. What can they expect to get out of this course?
Oh, this is, I get refreshed. We know that this is an industry that's exploding. And we're not just trying to push injectors out there to do what we're doing. We want to increase the safety. We want to increase the bar. It needs to become regulated. If it's exploding to this extreme, because now nurse practitioner can inject, your podiatrist can inject, your pediatrician can inject, your pharmacist can inject. So right now it's just, if you have a medical background, you can inject. Well, I think at this point, if it's getting that popular, we should have regulations. Like I'm not one for the turf war. I don't really care for it. I think there's
plenty of room for everyone.
I think there's plenty of room for everyone.
Yep.
I think we just have to. The main focus is make sure that everyone's safe. And heck, we're in modern medicine. Let's learn. This is actually fun. I love it. I have a blast every day.
Jacob, you bring up an excellent point, and I don't want to take for granted, or patients, listeners to take for granted that anybody could do this, that it's safe for anyone to do this. You just mentioned so many different practitioners can do this. Some experienced, many not experienced with this. What does a patient need to look for, when they interview a physician? If someone's in California, someone's in New Jersey,
right,
and they don't know about you, they hear this podcast. First of all, they should come and fly down and see you, right? That's
right.
Number one. But if they don't, what should they be asking their doctors or their practitioners when they go in to see them?
What type of training, certifications have they taken? How often are they doing this? Because even people who are injecting, if you're not injecting, let's say you come in for your nose, but you're pushing 1 syringe or 5 syringes a day. But let's say their lips or just maybe a little bit of chin augmentation. But if you're not doing nose consistently, you want to go to the guy who's doing the same procedure 100 times a day. That's what it boils down to, is because you can know about it, you can take the training courses, but you want somebody who's going to be consistent, who is consistently putting out good work. And when you do numbers like that, because in medicine you can run into complications, if you do numbers, you know how to handle those complications or potential complications and how to avoid complications. That's why I suggest going to somebody who's very knowledgeable and has a lot of hands-on experience with whatever aesthetic modality you're looking for.
Ask to see pictures, right? Befores and afters. Absolutely. Right?
But even pictures can be deceiving. We've had people steal our pictures on social media. And we have, luckily that we have such a big a fan base.
Yeah.
We've had doctors in Belize, taking our before and afters. We've had nurse practitioners around the corner taking our before and afters. So that can be misleading too.
Mm-hmm. And, we see things all the time in the news that patients are getting God knows what injected into
them. Oh my God, yeah, and especially if you're doing it at somebody's house. That's a red flag.
Kind of the number one rule?
Yeah,
that's if it's in a garage, you're in the wrong place?
Yeah,
absolutely. So your office is close to Bal Harbor?
Yep.
Here in Miami? What's the address? How do people find it?
1140 Kane Concourse. We're on the 5th floor. We're in the Dr. Miami Tower. He's a very famous plastic surgeon, if you guys aren't familiar with him. He's essentially the one who pioneered bringing plastic surgery into your living room through social media.
Incredible. And what's the office number? How do people reach you other than through Instagram?
Yeah, sure. It's 305-988-9504.
9504.
305-988-9504.
So Jacob, now that you're teaching, you're getting amazing results here. What are you looking to do in the next 5 years with your practice?
I'm looking to destigmatize the use of fillers and neurotoxins. Essentially, we know that this is what's coming, and we want to be prepared for it. And if you're going to learn how to do these techniques, I want you to learn from us. Because the lab coat for me, it doesn't mean much. Really, this is a collaborative state. When you come to see us, it's a collaborative state.
Yep.
We're taking out the sterile environment of getting injectables is thrown out the window. This is, nevertheless, the only time we're serious is when we're injecting. And you see these people taking themselves so serious, and I think that you're going to see in a couple years, because of social media and all these multifactorial issues coming into play, the availability of information. People are now knowing how safe it is. What I want to achieve is I want to make you the best version of yourself. In
order to do that, so that someone you mentioned, similar to people getting haircuts and doing these procedures, it's a routine schedule is best. So if someone gets a procedure done in January, what do you recommend as follow-ups? How many follow-ups throughout the course of a year to maintain that refreshed look? To not lose the results, to build upon what you've done from visit to visit?
Right, that's a good question. It depends on what you're getting done. But if you're looking to just have a clean forehead, no wrinkles, every 3 months you're going to have to stay on top of it.
Okay.
But if you're getting fillers, fillers are just to essentially replenish the fat content that you've lost throughout the years. Depending on where in the face, because it's like the skin underneath the eyes is the thinnest skin, right? So you want to use something that's really soft. So you might have to come in every 6 months. Versus the jaw, it may be every year.
So those are long-term results. So when people come in, they get these results. They're back to work. They're feeling great. Who are patients, or what kind of complications or contraindications would prevent somebody from doing a procedure with you?
Active infection in the area. If we're doing lips, like herpes simplex virus. Pregnant women, nursing women.
So that's about it.
That's about it.
So that's about it. And everything's done on site in your office. Is there any other provider in your office besides you, or you do all the procedures by yourself?
We have 2 other injectors. We have Dr. Fernandez, who is incredible, and we have Jessie Cabrera. Okay. She's also a CRNA. She's also a board-certified registered nurse anesthetist. All of them are absolutely fantastic. Great. I let them inject me.
And you look fantastic.
Thank
too.
you. I appreciate it. Well, that's I can't take all the credit. I come here too.
Yeah.
I love your organization.
Well, kind of the synergistic approach, as we mentioned earlier, is really working from the inside out, from the outside in. I think it's important to take a moment to just speak about what can you do to maintain your good health, your good physique, the way that you look, to prevent the deep-set wrinkles from progressing. And it's really building health from the inside. And we build protocols for patients to help balance nutrition, to help balance vitamin levels, and to help balance hormones bioidentically, which means they're safe, they're effective, and they can be done for long periods of time. But like you said, you have a specific mathematical formula that you use. You look at the eyes, the eye brush, and go to the end of the eye to be able to fit an eye right in the middle. We do the same thing when we evaluate blood work on a patient. There's so many people that are doing hormones. Of course, we live in Miami, but are you doing it the right way? 9 times out of 10, the patients that we get to our office have been somewhere before, and they weren't happy with the result. Something happened. Their face bloated. They gained weight, and they didn't get the results that they were looking for. It doesn't mean that balancing hormones doesn't work. It just means that you didn't go to the right place.
Right.
And so what we do is, before we do anything with a patient, we ask them the same thing. What are you looking for? There's so many symptoms and commonalities that patients suffer for when they begin to lose optimal hormone levels. Most people think it's just loss of sex drive. It's one of them. It's down on the list. But the inability to heal, poor healing, injuries that are common in the gym,
Absolutely.
tendinitis, bursitis, lack of concentration, underperformance at work, trouble with the marriage. Most people think that they're depressed. And yes, depression exists, absolutely. But oftentimes there's an imbalance of hormones like low testosterone and low vitamin D that correspond with those symptoms. So we order blood work, and we're looking at everything that's in a traditional panel, like the complete blood count, the metabolic panel, the liver panel. But the things that 9 out of 10 doctors don't test for, those are the most important things that we look at. Hemoglobin A1C. Can you process fats and sugars well over not just the day or week, but over the last 90 days? Testosterone, free testosterone. How much testosterone is in your blood? How much is your body absorbing and utilizing? Estrogen levels. Are you insulin resistant? Is your body aging faster than it can repair itself? Growth hormone, super important to know what those levels are, because if you're deficient as it relates to cosmetics, you're going to have hair loss, you're going to have deep-seated wrinkles. Women report that their ponytails get smaller and smaller over time. Hair loss, thyroid, adrenal function, all very, very important.
Totally. It's funny that you mentioned that. I was about 8 months ago when I was trying to organize the accreditation, to get our accreditation for our courses, and we had so many things up in the air. Can't tell you how stressed I was. Cortisol levels must have been through the roof.
Yes.
And I read the other day where if your cortisol levels, some of the hormones can affect other hormones in different parts of the body. Like high cortisol levels, correct me if I'm wrong,
yes,
could inhibit the release of T3 and TSH.
Right.
So then your body's metabolism slows down, and then you're gaining weight. And I'm like, man,
absolutely,
this must be me. This is it. I need to go see Dr. Joe.
It's so important about what you said. Thyroid. Most people, the only thing they know about their thyroid is by looking at TSH, right? The stimulating hormone. And most people, it's going to fall within a range. It's a pretty big range, about 4 points on a blood panel, which is an enormous range. Every now and then you'll see T4, T3, but you don't see free T3, free T4, which is what the body actually is able to absorb T3. But if you really want to know if you could burn fat, if you're a good candidate for a weight loss program, if your thyroid is in any way related to your inability to perform properly, to think clearly, there's six markers of a thyroid panel.
Wow.
And I bet you 90% of the doctors don't know that. So you have TSH, right, the stimulating hormone. You have the hormones that are produced by the thyroid. You have T4 and T3, the free versions of that. And then you also have something called reverse T3. So when T4 is converting to T3, T3 is the form of thyroid that the body absorbs. There's also a secondary hormone called reverse T3, same bioidentical marker. If that clogs the receptor site, even though you have normal T3 on the blood, you don't absorb it.
I did not know that.
And then there's thyroglobulin antibodies and thyroid peroxidase. So those are the autoimmune conditions that affect the thyroid. They're never tested for. I can't tell you how many times we found patients with Hashimoto's that struggle with weight loss, and they're on all these different diets they can't lose. So once you figure out, okay, that's an autoimmune condition, how do you heal the gut to prevent that progression? Patients lose weight, they feel better.
I love it.
Their hormones are getting balanced, their sex drive's coming back, their marriages are getting better, they're doing better at work. So, and the best part about it, it's safe, it's clean, and it's effective.
We live in such a great time.
Yeah.
It's incredible. We're so blessed and lucky.
To be doing it here in Miami too, where it's the vanity capital of the world, right? It's such an important place that we hold.
And it's so sad because I know who you are. Like Dr. Joe, you're the most this guy is the most humble gentleman I have ever met. And I met you through a good friend of mine, Robert Shapiro, who's also a humble soul. What you guys don't sell that. That's not what you guys are selling. You guys are selling like a holistic approach to the one life that you have. And that's essentially what we want. That's what we want to do. We want, if our legacy is going to be anything, is I want to create the best version of you while you live a positive, productive, influential life. The vanity doesn't mean anything. I know it's not. I'll be the first one to say it's not important. It's about everything coming together. If we're going to leave a legacy, I want it to be one that we were influential in others looking good while living their legacy.
Yep. And it's so important because, when you want to look good, you have to feel good too. We've heard about patients that want to do these procedures we mentioned earlier, and they feel like, oh my God, this is Beverly Hills type things. I'll never be able to afford it. Everybody could afford this. Yeah. It's the best part. It's Beverly Hills type of services that everyone can afford. Like we said, it's anyone who's listening to this podcast, everyone that's listening to this podcast, you can all get these services. If you need regenerative medicine, if you need to balance your hormones, apmrmiami.com is how you find us, 305-598-8788. Get Refreshed One. Right, Jacob?
Yes.
The thing that we share in common is the obligation is on us as practitioners to make it affordable to the patient. So they shouldn't even be thinking about finances. Find out if you're a good candidate. Get the consultation, meet with Jacob, meet with myself, find out what you need, find out what you want, and we'll make something work for you.
Absolutely. I want this to be attainable for everyone. We have single women, single moms that come into our practice. I want them to be to afford this. This is modern medicine. Why does it have to be for the rich and famous?
Right.
It really doesn't have to be. So yeah, I'm with you on that.
Yeah.
I'll make it work. You guys come in, and we're also rolling out a membership program. I'm gonna make this attainable for the country. I promise you.
Yeah, and it's a big obligation. I know you have a big staff, but you do it, and that's one of the great things about you, Jacob. That I've learned over the years too is that you're a people first person. You care about the person, the individual.
Thank you.
And and changing lives, which is really what it's all about.
Thank you. Thank you for always making me feel welcome. I love coming here. I really feel like it's family when I come here.
Yeah.
Everyone knows me by name, and I've only been here like a handful of times.
Yeah.
It's insane. But I was coming here for my rehab when I tore my ACL.
Yeah.
You guys are beautiful people. You
Yeah.
have the culture, the environment here is absolutely incredible. I highly recommend this place. Like, APRM is the wave of modern medicine. Stem cells, bioidentical hormone replacement.
Yep.
Even the machines that you have back here are incredible.
Yeah.
I wish I could take these things home.
Yeah.
I feel so great. I've walked in here, not being able to walk after trying to be a weekend warrior, and they've shot me up, gave me some ultrasound, some I don't know what it was, like O2 therapy.
Yeah.
And I've walked out of here. I wasn't even able to put on my socks that morning.
Yeah. It's amazing. Christina, who's our physician assistant, absolutely incredible. We get patients like you do. Sometimes they're desperate. They want to feel better. They're not ready for surgery. You change their lives. And just, one or two simple things, you can never underestimate the impact that has on someone. When someone can't perform and they're in pain, it changes their life in a way and sends them down a rabbit hole.
It could be a vicious cycle.
It
could be a circle that you're chasing your tail. I see it all the time in the hospital. People, they get back surgery.
Yeah.
They're immobile. They're not walking. They gain more weight. The back gets worse.
Yeah.
And it's definitely a vicious cycle.
And so we have our cocktail of things that we use, whether it's ozone and prolozone therapy, whether it's shockwave, high power laser, low level laser therapy. These things work. So if you're out there and you have neck pain and back pain, if you have low energy, low drive, Advanced Physical Medicine and Rehab.com, that's where you need to come. Call us at 305-598-8788 and find out what's going to work best for you. When we come back after the break, Jacob, you're going to tell us a little bit more about your certification program for physicians right after this.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
And we're back with Jacob of Get Refreshed. Jacob, we were talking last before the break about your certification program. I think it's so important. People need to know what you're doing. One more time, how do people find out about this program that you're teaching?
You can find us at Get Refresh 1 through Instagram. Also, you can also email us at bookgetrefreshbyjacob@gmail.com. But I got to say, this is one of the best master courses. I guarantee it. I back it 100%. I've flown all around the world taking master courses. And I've always been a huge advocate for teaching. So this is a blessing that I get to fulfill something that I've always enjoyed doing. I enjoy injecting, but also teaching is so fulfilling. This course is backed with research. It's to fill in all the empty holes that are in the industry right now. Mm-hmm. I went to it was one of the biggest aesthetic conferences in the country. They hold it every year. It was actually in Miami about 1 month ago. And no one's talking about complications, right? We know that this thing has increased by 6,530%, but no one's talking about potential complications. Now, the chances are very minimal, but we're talking about somebody's face, right? It should be addressed. You know, if you have, we have people who come in who we're injecting minors. Now, people are coming in, flying their 15-year-old, 13-year-old to have their nose reshaped with filler because they have a congenital abnormality that they were born with, and they know that's a very tough time to go through, high school like that. Or they were in a car accident. You know, we had this young woman who was 15 years old. She had 7 rhinoplasties. Oh my God! By 19 years old. You know the amount of scar tissue that's in there? Mm-hmm. She didn't want to go under the knife again. So she came to us, she flew in. Her nose came out absolutely fantastic, beautiful. Mom, Dad, her are all crying. I love it. But you have to be worried about the scar tissue that's in there. Yeah. The nose has expensive real estate. You got vessels that are traversing through there that if you don't know what you're doing, you can really injure somebody. You can even impair their vision. And this is about how to manage that, how to prevent that. And I don't think there's any courses out there. They're showing you the technique, but they're not showing you the safest way to do it. They're not showing you how to prevent a complication. Yep. They're not showing you how to deal with the complication. And I think that's where my background in anesthesia, where your job is to maintain cardiopulmonary status through an operation, through a stressful period, and having that thought process. Don't put yourself in a corner you can't get out of, and then backing it by research. On top of that, I mean, the outcomes speak for themselves. Yeah. We got people coming in from all around the world. They're like, how are you doing this? We have other specialties are saying that is absolutely fake. There's no way. It's Photoshop. You know, like I mentioned before. So they're coming in. The people who jump on it first are going to benefit. On top of that, you got a lot of hands-on. So we actually will have models where you can actually do you can perform the latest techniques. I want you to be good. Our job is not to make you a better injector, it's to make you successful.
And where do you see this going in the future, Jacob? Do you see this spreading, and maybe it is already? Are you working on hands? Are you working on other body parts?
That's a great question, yes. Yeah, absolutely. Yeah? When I look at someone, being that I'm in this field, they ask me, how old am I? I'm like, okay. I don't look at the face. I look at the hands. Yeah. You know, I look at the neck. I look at the décolleté, which is that cleavage area. So I can determine, okay, because you can keep up with your face, but are you Are you? I mean, you're driving. Your hands are exposed all the time. Especially if you work outside, and those are areas that people neglect. So yeah, we're using fillers off face, off label, and those are things that you can learn at our courses as well. There's a lot of research that's coming out of Europe and Australia of using ultrasound guidance, to emit energy to the lower layers of the skin to produce your body's inflammatory response so you can build collagen. So it's a multimodal approach. We're using fillers that have a biostimulating factor that's helping your body produce collagen.
Mm-hmm.
So we're also using PDO threads.
PDO threads, yep.
That's very popular as well.
Are you doing any techniques that you're utilizing, any type of PRP or any type of tissue grafts that contain stem cells, using patient stem cells?
We were doing PRP, but it was actually talking through Robert Shapiro. Like, well, PRP are kind of outdated, right? You're taking like cells that are just like one generation back and putting them and injecting them back into an area.
Yeah.
Is that?
It's exactly, PRP, yeah, and it's dependent upon the age of the patient. So the younger the patient is, the stronger those platelet factors, those growth factors are going to be. Yeah, you're using a secondary growth factor that's produced by a cell, putting it back into the body.
So we've done away with PRP.
Yeah.
We're looking into more advanced techniques, like stem cells, or bioidentical hormones.
Yeah.
Those are the things that I think that are going to be in the near future for Get Refreshed.
Circling back to how we parallel is we started out, treating joints and muscles with PRP as well, because it's interesting in that when the body breaks down, there's certain tissues of the body that wear out much, much faster than others. In fact, there's really about 4 or 5 that once they're injured, really lose the ability to heal forever. It's the discs in your back, it's the cushions in your knee called the meniscus, and it's the labrum in the hip and in the shoulder. Why is that tissue different than your bicep, your tricep, your quads, and your glutes? It's because it doesn't have an active blood supply. Mm-hmm. So in orthopedics, we look at blood as being a carrier, a transporter of oxygen. If you combine a damaged tissue with enough oxygen, it's going to regenerate and heal. And so in orthopedics, when we see someone with a really bad knee or a bad hip or a bad disc, we have to find ways to get oxygen into those tissues, around those tissues, so that the body can start to repair itself. Again, it's working with the body, not against it. One of the greatest things we found in our practice is that to really break this down in simple terms, if you are stuck and you have pain, it's telling us one of 2 things. Number 1, stop doing what's uncomfortable. Number 2, your body's stuck in a phase of healing, because inflammation and pain is part of the healing process.
Right.
So it's the first phase of the injury. Second phase of the injury is something called stem cell migration. Stem cells will always be some of the first cells, along with blast cells, to move to the site of damaged tissue. But can they get in? Can they access? Can they interact with damaged cells and tissue is the question. Mm-hmm. If there's oxygen present, yes, and you'll heal and the pain will lessen and go away. If there's not enough oxygen present, you can't heal and the pain will persist.
So is this oxygen or blood, which oxygen is being carried by the...
Well, so it's a great question. The specific tissues that we just referenced, the disc, the meniscus, you'll never get a blood vessel to grow into that tissue. So what you can do is push oxygen and blood, dilate blood vessels to move over that tissue, and then the body does the rest. Once you get enough oxygen in or around a tissue, your stem cells are going in. And that's the beginning of the healing process. That's when inflammation starts to ramp down. And when your body reduces inflammation, you're healing. When you reduce inflammation with a drug, you're not healing, you're just masking a symptom and getting worse over time. So, we talk to patients and we really digest a lot of this information. It's very complex and break it down into 2 ways. If you're not healing, number 1, is there poor circulation to the joint? It depends on where the condition is. If it's a disc, if it's a meniscus, if it's a labrum, yes, absolutely. That has to be addressed. Before we even talk about regenerative medicine that contains tissue grafts with utilizing stem cells. There's so many offices that utilize stem cells, but are they doing it correctly? The answer is no. Having a fellowship in stem cell therapy taught me that. It's a lot of education to be able to know what cells to use, when to use them, who to use them on, and what environment do those cells need to be used in to get the best results. 99% of doctors that utilize stem cell therapy don't combine it with oxygen therapy. Like you said, you want everybody to know what you do. I want every doctor that's listening to know about this therapy so they get better results with their patients. Because if you correct a circulatory problem, and depending upon the patient's age, if they don't have enough stem cells, if you add more tissue grafts and cell tissue products that contain stem cells, patients are going to improve. It's that simple. So if you're out there with knee pain and back pain, call 305-598-8788. Look for our website, apmrmiami.com, and find out if you're a candidate.
How do you feel about, most of these clients are they're probably going to an orthopedic surgeon or some type of ortho doc before they're seeing you.
Yes.
A lot of the times, right?
Yes.
And these docs are either not familiar with it,
Yes.
or they're more like tertiary care, right? Like it's more about,
Yes.
okay, let me fix rather than prevent, and let me use a hammer.
You're
drills.
exactly right, and I don't blame the doctor per se, because they don't know about these conditions. It takes, like you said, I grew up always wanting to help people. I'm more humble in the sense that I have a small ego when it comes to helping my patients. I have a big ego when it comes to learning as much as I can to help my patients. But I would never discourage a patient from getting another opinion. And doctors are not there, and they shouldn't be there to do that either. 99% of the doctors that say patients should not get a consultation for stem cell therapy, it's because one of two things. Number one, they don't know enough about stem cells, or number two, they have a big ego. And because they don't know enough, they're unwilling to let their patients know that there is something else out there. What do they do instead? If you're not a candidate for surgery, they give you medication and say, come see me when you are. And you leave the patient in a basically a dark area where they're hopeless. And so, like we were talking off air before, is that it's not we think stem cells work; they work. It's a fact. If you didn't have stem cell activity, you wouldn't be alive. And we're talking, so I know you're alive.
Yeah, it's so comprehensive.
And when you utilize it with oxygen therapy and you catch it early, patients are going to get better. And pain reduces, subjective findings get better, they have less pain, and they have better performance. We want everybody to live to be 100. Technology is getting there, where patients are living longer, but they have to live longer with good quality. Nobody wants to be 90 years old, 100 years old, and you can't walk.
Absolutely.
So it's the whole body, which is why Get Refreshed and APMR work so well together, right? It's being able to navigate yourself through this life of ours. We only get one. Do it the right way. Do it the best way.
Make it count.
Make it count. Surgery in orthopedics should be your last option, not your first. There are conditions and times where it absolutely is the best option, but it's not the majority of times, as you may believe.
Yeah.
So, it all segues together. I had such a great time talking to you tonight,
Man,
Jacob.
The pleasure was all mine. Thank you so much for inviting me, Dr.
Well,
Joe.
we're going to be working together. I know you're going to be getting into some of these bioidentical courses and peptides, and I'm here to help you along the way too. Miami's a big place.
Yeah, definitely. You've been my mentor for years. I've looked at what you've done and how you've grown your practice, and how you carry yourself, and I'm just grateful to be sitting right next to you.
Thank you so much. It's the wave of the future. Bioidenticals really, make what we do so much easier. Because when you could treat a patient and they're not coming back for 3 or 4 months, to maintain the best results, you have to have balanced hormones. You have to be well hydrated. You have to maintain a clean, healthy lifestyle. When patients get a knee treated with us, they have to maintain a clean diet. They have to drink water. So there's so many similarities and carryover that is pretty much a baseline that works, whether you're talking about cosmetics, whether you're talking about physical health, or just longevity in general.
Absolutely. It's treating your body like a temple.
Yes.
It's an amazing machine.
Yeah. So, Jacob, you're an incredible person.
Thank you, Dr. Joe.
People are going to find you on Instagram at GetRefreshed1.
You got it.
Your office phone number?
305-988-9504.
And you're in beautiful Bal Harbor.
Yeah, it's beautiful. If you're not coming for us, come for you got Bal Harbor shops, you got the beaches. It's absolutely beautiful. Stop by, say hi.
So it's like the Beverly Hills of Miami. They're getting Beverly Hills quality, but they're not paying Beverly Hills prices.
Absolutely.
Because everybody can afford these things.
I am for the people because I am one of them.
So I'm Dr. Joe Gambardella from Advanced Physical Medicine and Rehab. I'm so glad you listened today. And remember, repair, replace, regenerate. You get one body. Make sure you take care of it. And we'll see you next time.